So I'd like to start off our presentation by introducing our members. So I'm Aaliyah, and this is Sierra, Victoria, and Selena. We'd also like to take this time to thank our guests, Dr. Yekatan, Ms. Hilfrat, Mrs. Friesen, our bio teacher, Mr. Weeb, and then guests in our classroom, as Chloe mentioned, Mr. and Mrs. Bauer. So within our presentation on CBD, you'll be hearing about 4 possible treatment options, including genetic counseling, natural remedies, medication, and finally surgeries. Following our presentation, there will also be a short game like the Kahoot, so if you still have it on your phone, that's great. If not, you can pull it up. We'd encourage you to play because we also have prizes. To review any information, you can look at the brochure. It's the light blue one in front of you, or on our website, www.cbdtreatment.weebly.com. So genetic counseling is the process by which patients at risk of an inherited disorder are advised of the consequences or natures of that disorder, the probability of developing or transmitting it, and the options open to them in management and family planning. These tests are done by taking and analyzing blood or body tissue samples. The official definition of genetic counseling is the process of evaluating family history and the patient's medical records, ordering genetic tests, evaluating those test results, and helping patients to understand and reach appropriate decisions on the following steps to take. What a genetic counselor does is they will guide you through decision-making regarding genetic testing, as well as provide additional resources for families dealing with CBD. Some of the things that they look for when doing these testing is a history of heart attacks, anybody in the family that has pacemakers, a history of fainting, abnormal heart rhythms, or recent heart surgeries or failure. So personal and family history plays a role in helping the genetic counselors. They use a family tree along with technologies that help to enable the manipulation of the genome, and that's used as the initial screening process to identify potentially inherited defects. Genetic assessment can predict the reoccurrence rates, define the pattern of inheritance in a family, and as well as evaluate the need for further family member screening. So I'm going to talk a little bit about genetic counseling and congenital heart disease. So congenital heart disease is a condition that you're born with, and it happens when the heart or blood vessels near the heart don't develop normally before birth. CHD is the most common type of birth defect, and the initial screening process or tool used to identify this defect is again with that family tree. And these technologies have created many opportunities to study the roles of specific genes and the ways they affect physiological and behavioral processes and the development of the inherited defect.
All right, so this has been talked about quite frequently, but natural remedies and treatments are a great and healthy alternatives to lower hypertension and maintain a healthy heart and body, as well as prevent any cardiovascular diseases in the future. Just a simple change of diet can make a world of a difference for your health. Alright, so just a couple things that you can add to your diet are herbs and supplements. So omega-3 fatty acids are helpful to lower levels of fatty blood content that block your arteries, making the blood flow better. You can also start taking magnesium and potassium supplements. They're great for reducing blood pressure and overall heart function, and potassium does that as well. It provides heart function as well as helping offset the rise of high blood pressure. All right, and adding green tea into your diet as well is pretty good too, because green tea is full of antioxidants. So basically, antioxidants have the ability to protect the heart, and antioxidants are great for your body because it cleans up all the toxins. And studies have shown that people that drink 5 to 6 cups a day have seen significant benefits in their health. Pomegranates also have a high content of antioxidants antioxidants, and they also have chemicals in the fruit and in the fruit juice. And when you consume the fruit juice and the fruit, it helps reverse atherosclerosis, a type of cardiovascular disease, and lower blood pressure as well. Also, adding fresh garlic to your diet slows down the development of hardening of the arteries and also improves circulation. And this is more of like an extreme thing if you are up to it, I guess. Diet change. So one of the diet changes that you can consider is becoming a vegetarian. And basically with that, you eat a lot of fruits and vegetables, which are great for your diet. And you consume a lot of, well, it's suggested that you consume a lot of whole grains, which are great for your health as well. And lots of protein like supplements, I guess. And also like legumes, nuts, low-fat dairy, and egg whites are full of protein as well. There's also a diet called the Italian cure, and so basically what that is just replacing olive oil with any like butter or anything high in cholesterol. And so I've tried this with salad, so instead of using like salad dressing, you can use olive oil, and it's a great healthy alternative for you and your heart. It also tastes very good as well. You can also include a lot more walking into your daily activity, and so walking helps lower blood pressure, and if you add at least an extra half an hour into your day, it's great for your body, obviously, get that physical activity in. And yoga and meditation is a great way to reduce stress, and reducing stress also reduces hypertension, which is one of the main reasons of cardiovascular disease, and it is great for your overall physical and mental health.
I'll be talking about the medications that you can take. There's lots, as you can see, but there's even more. I'll be focusing on two specific ones, which are the ACE inhibitors and angiotensin II receptor blockers. So the ACE inhibitors are medicines that are used mainly in the treatment of high blood pressure, heart failure, also in some forms of diabetes, some kidney failures, and after heart attack to protect the heart. ACE inhibitors have the ability to relax blood vessels, which is really important. Some examples are altase, caproten, and lutensin. And side effects are cough, sore throat, fever, mouth sores, red itchy skins and rashes, dizziness, and salty and metallic tastes, and sometimes you don't have any taste at all, and kidney failure and severe vomiting. The second one I'm focusing on is angiotensin II receptor blockers, also known as ARBs. These are for high blood pressure, heart failure, kidney failure, with people that have diabetes and chronic kidney disease. So these angiotensin II receptor blockers help relax your blood vessels, which lower your blood pressure and make it easier for your heart to pump blood. Angiotensin is a chemical in your body that affects your cardiovascular system in various ways, including narrowing your blood vessels. This narrowing can increase your blood pressure and force your heart to work harder. Some examples are azilsartan, candesartan, eprosartan, and irbesartan, and losartan. And for this medication, there's only a few people that have side effects, which includes dizziness, elevated blood potassium level, and localized swelling of tissues.
So the next treatment I will be talking about is heart surgery. Heart surgery is done to fix problems with the heart. Doctors use heart surgery to fix heart valves, repair damaged structures in the heart, or to replace a damaged heart with a healthy heart. Heart surgery can reduce symptoms, improve the quality of life, and improve the chances of survival. So before the surgery, your doctor will talk with you and do tests to learn about your general health and your heart problems. We'll discuss the test results with you and help you make decisions about the surgery. You may also have blood tests or an EKG or a chest X-ray taken. For the traditional open heart surgery, you will be given medicine to help you fall asleep. A doctor will check your heartbeat, blood pressure, oxygen levels, and give you during the surgery.
Your surgeon will make a 6 to 8 inch incision down the center of your chest wall, and he will cut your breastbone and open the ribcage to reach your heart. During the surgery, you will receive medicine to thin your blood and keep it from clotting. A heart-lung bypass machine will be connected to your heart. This machine will take over your heart's pumping action and move blood away from your heart. Once the bypass machine starts to work, surgeon will repair your heart problems. It will restore, once the surgery is done, they will restore the blood flow to your heart. Usually your heart will start beating again on its own. So this surgery usually takes about 3 to 6 hours. After the surgery, you may spend a day or more in the intensive care unit, depending on the type of surgery you have. When you leave the intensive care unit, you will be moved to another part of the hospital for several days before you go home. After effects of heart surgery are normal. They may include muscle pain, chest pain, or swelling. Other after effects may include loss of appetite, problems sleeping, mood swings, and depression. These usually go away over time. The doctor may recommend lifestyle changes and medicine to help you stay healthy. These changes may include quitting smoking, changing your diet, being physically active, and reducing and managing stress. Risks of heart surgery may include bleeding, stroke, infection, fever, swelling, and damage to kidney, liver, and lungs. In general, the risk of complications is higher if heart surgery is done as an emergency, for example, during a heart attack. The risk is also higher if you have other diseases or conditions such as diabetes, kidney disease, or lung disease.
Alright, so I hope you guys were listening because we're also going to do a Kahoot and we also have prizes. So yeah, now's the time to grab your phones and you can type in the little PIN number once it is up on the screen. Alright, is that everybody? I'll take that as a yes. Who's first place?
Click get results.
All right, first place.
Can you do get results? I want to see what I got. Aaliyah, click get results. Yes, please. I want to. Thank you. Dang it.
So that concludes our presentation for this evening. We'd again just like to thank you all for coming out and hope you enjoyed it.